I'm Tungai Gwarisa, and you're listening to Ruwende on Capi Talk 100.4 FM.
We don't negotiate.
No.
We take no prisoners. We are here to rule. Capi Talk 100.4 FM at 8. Harari's Heartbeat. #Dominate.
The Exchange on Deep Dive.
It is a warm welcome to Monday's edition of The Exchange on Capi Talk 100.4 FM. This evening, we want to take a look at STI, sexually transmitted diseases, the misconceptions, the prevention, the status, the prevalence of these diseases in Zimbabwe. And this comes after news of a drug-resistant strain of gonorrhea that's doing rounds in Zimbabwe and beyond. So that's Dr. Misheck Ruwende, who took to social media to post that in particular. And, it got us thinking that we need to have a deeper conversation around what's happening here. How can you protect yourself? What are the most common types of STIs currently affecting people in Zimbabwe? How can you get treatment? And there are some that have no symptoms but long-lasting consequences. So let's talk about this as we continue to move in the step and the trend of good health-seeking behavior. So we did also take an opportunity and a moment to speak to Micheal Gwarisa, a health journalist, also sharing his views on this very important subject. So we start things off by taking a look at some of the most common types of STIs currently affecting people in Zimbabwe. And of course, we welcome our guest into the conversation. So that's Micheal Gwarisa, a health journalist. We also will be joined by Dr. Misheck Ruwende as the conversation continues. To start us off, Micheal, what are the most common types of STIs and who are they affecting in Zimbabwe?
Okay, thank you. So, according to the Minister of Health and Childcare, currently a number of STIs that are affecting people in Zimbabwe. So, I think from data from 2024, yes, from 2024, the Minister of Health and Childcare officials, I could say. They actually indicated that the STI burden in Zimbabwe is actually greater than the available data. So, in terms of the STIs that are affecting people in Zimbabwe, you find that vaginal discharges in women, as of 2024, they constituted majority of STIs recorded in Zimbabwe, with data showing that an estimated 95,000 cases were recorded in 2023. So the data was released in 2024. And then you have urethra discharges also, which constitute about 80,000 of STIs recorded in 2023, while other forms of STIs make up, about 55,000 cases. And genital ulcers have also been there was also an upward trend in genital ulcers in 2023, with an estimated 40,000 cases recorded in 2023 alone. So this is according to data from the Ministry of Health and Childcare. So we find that in men, for example, urethra discharge, you need to cut this part out. So majority of men over 70%. Were recorded to have around, to have gonorrhea. That was the most popular STI in men. Yeah.
Quite worrisome to hear that the most popular STI in men are gonorrhea. Michael, not too sure about the statistics. They are saying over 70%. So how can someone know that they have an STI? What are the early signs and symptoms to be on the lookout for?
Symptoms vary depending with the STI that one will be having at any given time. So symptoms may include unusual genital discharge, sores or blisters on or around the genitals, pain or burning during urination or even during sex, and sometimes itching in the genital area. So, like I indicated, symptoms can vary, and it depends with which type of STI that you're having. But if you have any of the symptoms that I mentioned above, I'll just, if you have had a sexual encounter, unprotected sex, you might also need to check with the health authorities and health professionals and experts in health facilities. Then, in terms of STIs also that are being reported in Zimbabwe, you find that around 2021, experts they actually indicated that there was a rise in a drug-resistant sexually transmitted infection. I did an article. You can find the article in Health Times. And an expert, I think it was Dr. Francis Ndoa, is a well-known expert and expected in these areas. And he indicated that these STIs that were being reported in Zimbabwe, the drug-resistant one, they were now resistant to the usual antibiotics that are usually prescribed or administered to anyone who test positive or who shows signs, positive signs of an STI. And he actually indicated that by 2021, Zimbabwe was now on the last class of antibiotics that is administered to people with STIs, which means all the the usual STIs that are administered. I would want to go through them name by name. I'm not a clinician, but in people who present with this STI that was drug resistant, they were resistant to all the antibiotics that you were used to, and now we were on the last class of antibiotic called cephalosporins, something like that. Yes.
Quite scary indeed. I'm seeing your messages at 0719100404. Quite a worrisome trend. My STI Rwanda in this country, not just in this city. And what's worrisome is that Anzipane are totally drug resistant. So no matter what sort of medication you get, they won't go away. So you talked about some of the signs, the symptoms there. Are there any persons who might have an STI without showing any symptoms?
Right. So to answer your question, whether someone can have an STI without showing any symptoms, very true. So last year, we had a meeting with the Minister of Health and Childcare experts around the issues of STI. And they indicated that the biggest problem about the STIs in Zimbabwe was that, majority of infected patients do not even show the signs, and they could be spreading the STIs unknowingly. So yes, it is very, very possible to have an STI and not even know it, and at the same time be infectious and spread it to other people.
So beware, particularly because you could actually not know that you are carrying an STI and continue on to spread it. And with the drug-resistant variety, it's important that we take on responsibility when we are wading in these waters. Then we also just wanted, before we let Michael go, just find out the differences between bacterial, viral, and fungal STIs, and whether or not STIs are treatable or curable, which ones are permanent and cannot be cured.
Yes, STIs are curable. Unlike HIV, STIs can be treated. There's you can use antibiotics for STIs. But however, Having STIs is a sign that people are engaging in unprotected sex. So who would want people to have STIs? Because the two work hand in glove, like HIV and STIs. Sometimes the fact that you are always at risk of having STIs means that your risk of getting infected with HIV is actually very, very high. So in as much as there is treatment for STIs, the risk of getting infected with the HIV is very high, because that just shows that somebody is engaging in risky sexual behavior. And in some instances, the STIs can be drug resistant. So sometimes, because higher regimens of treatment might actually cost an arm and a leg for others, they might go untreated, and in the event this might worsen the problem, whereby a drug-resistant strain of STI might actually spread just because somebody is not getting treated. So the most effective ways of preventing STIs, I would say, just exercising restraint, during sex, practicing safe sex, not engaging in, unsafe sex where there is no condoms. Use condoms. I think condoms have been proven to be, some of the most effective prevention tools against STI.
He says there, prevention. Take measures to ensure that you are engaging responsibly and keep yourself safe from sexually transmitted infections. Now, the thing with infections like this is, people think they're engaging in this behavior under the cover of night, but then, when the crabs come to call, or when you start to feel something happening, there are causes, and you need to go and get checked. Thankfully, most STIs are curable using antibiotics, and you need to then be sure that it's all gone and that it's not drug resistant. Many thanks to Micheal Gwarisa, health journalist, editor of Health Times, just giving us some very important information on our subject of discussion this evening. We now want to connect with Dr. Misheck Ruwende to get some more on this one. Prevalence of drug-resistant STIs is something that's of great concern. With such a young and active population in that demographic, then it gets scarier because underage children are indulging, and if there's so many STIs, can you imagine what will that do? So these are important conversations that we need to be having and encourage each other throughout this whole month. So women, as the most popular STIs are women with some sort of discharge. So in this month of October, we're encouraging you to understand your body, go and get screened. Anything that doesn't make sense, anything that's not normal, speak out early. It might be an STI, it might be cancer, you never know, but go and get yourself screened. Also practicing conscious health, good health seeking behavior are very important. Aldo Samaranga coming in. It's Capital 100.4 FM. This evening we are talking about the prevalence of sexually transmitted infections in Zimbabwe. The statistics are shocking. You did hear my first guest there, just really encouraging all those who are active to take precautions.
We calculate.
8.
We elevate. We innovate. But above all, we dominate. Capi Talk 100.4 FM at 8. Harari's Heartbeat. #dominate.